कितना खाओगे तुम अभी?
Iya. Oh, berani. Oh, ini
Hi, good evening, everyone. Thank you for joining us today. We'll be beginning in another 2 minutes more. Thank you.
ऐसे ही हालात हिमाचल के आ गया और गाड़ी की फंसी। चमोली और चंबा में तो पहाड़ दरकने लगे, पत्थर अचानक नीचे बरसने लगे। जब देखिए गुजर के क्रोध की तस्वीर, जहाँ इंसान बेबस है, अचानक चट्टानों के आने से यहाँ से बंद हो गए।
और तो कुछ भी नहीं है। होते हैं तो सर आपको सिग्नेचर पर ही बात करने का है, तो आपका अग्रीमेंट लेकिन उसके भी कुछ तौर पे है। तो आपको कुछ ऐसा नहीं करना और इसके साथ हम लोग वो लोग ना स्वतः आपको जगना उलवना था એટલે સીધા સીધા વાત કરી તો મને તો ઓલો થાય કે ના થશે તો અંદર બેસીને ડર લાગે છે
Good evening, everyone. Thank you for joining us today. My name is Dr. Runa Sinkar. I am the Associate Director of ID Education Academy here at ID Head Office, Mumbai. On behalf of the Indian Dental Association, I extend a warm welcome to all of you for joining us today for a special session on Global Education Program, the UK Pathway, which is in collaboration with Smile Dental Academy UK. IDA has always stood for empowering dentists to thrive, not just in India, but anywhere in the world. And the Global Dentist Program is a step towards that vision. So whether you're already on this career path towards UK, or you are somebody who is just exploring international opportunities, today's webinar is designed to guide you through everything you need to know about the Overseas Registration Exam, which is ORE, and how to confidently pursue a dental career in the United Kingdom with the mentorship of UK-based faculties. We are privileged to be joined here by an exceptional panel of educators and mentors from Smile Dental Academy. Smile Dental Academy has been training international dentists since and they have trained more than 1,000 international dentists to pursue a dental career in UK. Joining us today are Dr. Jin Waghela, Dr. Kish Patel, Dr. Victor Gihani, and Dr. Anita Pradhan. Dr. Jin, Dr. Kish, Dr. Victor, and Dr. Anita, can you just turn on your camera so that all of us can see you all here?
Good afternoon, everyone.
Hi,
Hope you're doing well. Our cameras are on. For time's constraint, I'm going to share my screen if that's okay, so we can continue.
So let me just quickly introduce Dr. Jin and Dr. Kish, are the CEO founders of the Smile Dental Academy, exceptional clinicians themselves, and even better academic tutors. Dr. Victor Gehani is a former ORE examiner, bringing the first-hand experience of knowing the entire process and structure and assessment of ORE training. Dr. Anita Pradhan, she is one of the most experienced ORE trainers in the UK, and she has helped thousands of dentists succeed, particularly in the Part 2 training purpose. So on behalf of the Indian Dental Association, I welcome all our esteemed panelists today. Thank you so much for taking out the time. So I request all the attendees to please post any questions if you have, put it on the chat box, and we will address them at the end of the session. And we have one very exciting and important announcement to make for all of you all who are planning to have a dental career there in UK. An important announcement is coming up towards the end of the session, so stay tuned for that. And now, without any further much ado, I will hand over to Dr. Jin, who can start with the webinar right now. Over to you, Dr. Jin.
Many thanks. Firstly, it was a big warm welcome to each and every one of you. Good afternoon. Hope everyone is doing well, and I appreciate everyone's patience. Firstly, Dr. Kish, can we see the slides? I just want to confirm that.
We can indeed.
Amazing. So it's an honor for us to be working together. You've got an amazing team joining us here from the UK. We've got the amazing Dr. Victor Gihani, an ORE past examiner himself, who's got a vast years of experience and supporting clinicians. We've got Dr. Anita, myself, and Dr. Kish, and we're going to go through the program itself and our partnership as well. Hi, I'm Dr. Jin.
And I'm Dr. Kish.
We're from Smile Dental Academy in the UK, and we're super proud of our new collaboration with the IDA, the Indian Dental Association. So we are very, very proud to introduce all of you to the Global Dentist Program, Pathway to Dentistry in the UK. The IDA has approached us, and with over 75,000 dental professional members and 33 state branches, they wanted to provide high-powered education in India themselves. And us in Smile Dental Academy in the UK, we are now partnering up with the IDA to bring ORE, overseas registration training, to India itself. So, Dr. Kish, do you want to go through the Smile Dental Academy and what we do?
Absolutely. A warm, warm welcome. And again, thank you very much to the IDA for organizing this amazing webinar and really looking forward to discussing the pathway to a career in the UK with you all today. So for us here at Smile Dental Academy, our ethos is to educate and to energize the entire dental profession. And we are actually the largest postgraduate academy in the UK, doing courses right through from webinars to short courses, all the way through to diplomas, and finally to master's levels. So we've done over 12,000 webinar with delegates. Over 4,500 people have been trained in person, and we run over 300 courses a year annually here in the UK, in Dubai, and the USA as well. And we're looking forward to helping everyone in India at the same time.
And our values at Smile Dental Academy are learning, growing, supporting each other so we can excel within dentistry and make fruitful careers for all of us. And we do this with our amazing partners who support us globally as well, which all of you will have experience now with as well. So, dentistry in the UK. Currently, we have 43,000 registered dentists in the UK. There is a huge shortage of dentists in the UK to support with not only NHS services, but with private dentistry as well. Currently, there's a backlog of clinicians trying to pass the examination, and currently, 52% of all the applicants applying to the examination are from India. So there's an estimated shortage of around 11,000 dentists across both NHS and private practices in the UK. So there are two main entries to do dentistry as a dentist in the UK, and you must be registered with the General Dental Council. Before I go into the ORE exam and LDS, I want to introduce Dr. Victor Gahani, who's a very close friend, a mentor, a leading clinician and educator in the UK. Victor, how are you, my friend, today?
I'm fine, thank you. I hope you can hear me.
And I appreciate
Yep.
you joining us from stateside as well.
No, thank you very much. Good afternoon, everyone. Warm welcome from myself to all of you. It's a pleasure once again to always work and affiliate with the Smile Dental Academy. It's like coming home to a family full of wonderful dentists. So good afternoon, Kish, Jin, Anita, and everyone else in India. My name's Victor. I've been an ORE examiner a few years ago. And more importantly, I think what's important to add is I am from India myself. I trained in Pune and came over from India in the year 2001 and sat the previous version of the ORE, which was the IQE. So over the vast 20 years or so, I've had various opportunities to train Indian dentists and overseas dentists from not just India, but all over the world. And acting as an examiner, I was involved with writing certain questions for both part one and part two, and examining for the mannequin and for the diagnosis treatment planning part of the exam, which I'm sure we will discuss. So a warm welcome from me, and it's a pleasure to be affiliated once again with Smile Dental Academy. Thank you, Jin, for the invite.
Many thanks, Dr. Gahani. So there are two routes to work as a dentist in the UK, the ORE exam and LDS. And we have a lot of questions and messages regarding the differences between both and how it works. So if we look at the ORE exam, this is conducted by the GDC. It's held twice, so you got part one and part two. And we're going to go into more detail regarding this shortly. Part one again includes multiple choice questions, and part two is an OSCE-based, mannequin-based procedures you do. This leads to registration with the GDC. The ORE has increased the number of slots, so there's a lot more opportunity to get placement to do the ORE exam. The LDS, which is a license in dental surgery, is conducted by the Royal College of Surgeons of England. This is at the moment held once a year, hence meaning places are very limited. It's highly competitive, and normally there's a ballot to enter, which means it's you're going to be very lucky to get a place with the LDS. The structure of the exam is very similar to the ORE with written components and practical exam as well. And on completion of the LDS, you are registered with the GDC as a dentist as well. So both are routes to dentistry as a dentist in the UK, but currently ORE is a much more easier to get a place on the examination route, and they are increasing numbers as well. So this is a quick overview regarding ORE and LDS, and we'll answer more specific questions afterwards. So the exam itself and how does it work with the GDC? Kish, do you want to go through ORE Part 1 exam?
Yeah, absolutely. So the ORE Part 1 exam, the purpose of this is to test the candidate's application of knowledge to clinical practice. So the structure is two computer-based papers lasting 3 hours each. And the question type is pretty standard. It's a multiple choice questionnaire with some EMQs, which are extended matching questions, and single best answer response as well. So as I said, there's two papers. Paper A covers clinical dentistry, law and ethics, and health and safety. Paper B covers all aspects of clinical dentistry. Now, this includes treatment planning to cross-infection control, medical emergencies, radiography, radiology, pathology, microbiology, and pharmacology. And all of it is linked back to evidence-based dentistry. So you must pass both paper A and paper B to proceed to ORE Part 2 examination.
Many thanks. And currently, Part 1 examination dates, they've got 3 openings. So they do it in August, which is coming up soon, in December and April. Bookings open normally 8 weeks prior to the examinations, and there are 600 places per exam. The exam is currently held at King's College London, which is in central London. Then once you've successfully passed Part 1 exam, you can now sit the Part 2. And this is a protest which is then held in London itself as well. You got different components, so it's held over 2 or more days, consisting of 4 components. You've got a mannequin test, which means you work on a simulation, phantom heads, and you have to perform 3 operative dental procedures. This could be cavity preparation, crown preparations, and this is observed by the examiner. The second part is your OSCE. Kish, if you can just mute the delegates as well, that'd be great. Thank you. The second part is the OSCEs, which is an objective structured clinical examination. Again, you got 20 stations, and these have live actors. And these stations could include history taking, some diagnosis, showing your communication skills, or interpreting radiographs or photographs. The third part of the ORE Part 2 is diagnosing and treatment planning. And this includes interpreting a case study, usually written with radiographs. And then the final part is your medical emergencies. And this is a practical and written test. So you need to demonstrate CPR and handling common emergencies within a dental practice. So you must pass Part 1 before sitting Part 2. You are allowed a maximum of 4 attempts at each part. And they're very limited time slots. And you must pass Part 2 within 5 years. Again, Part 2 examinations, they've increased the number of places. We've been working very closely with the government and with the GDC. And now they do 4 sittings a year in September, November, January, and April. With each sitting, there's 144 places. So again, places are limited, but we're working very closely with the GDC and with the government in the UK to increase the number of placements for ORE Part 2. So all of you thinking, how do we pass it? Again, Kish, if you can mute our delegates, that'd be amazing. As Kish mentioned, we are providing the full, complete pathway and supporting you in collaboration with the IDA. Again, it's a huge honor for us working with Professor Doble. And what we want to do is give you the full pathway and support. So at the moment, we've got an introduction webinar. They're going to be supporting you with registering for the ORE. What that means is you need to supply the GDC with very specific documents, and we will support you and check these documents as well. Then we've got our ORE Part 1 course. In the ORE Part 1 course, we're going to cover everything to do with ORE Part 1 to give you the best chances of passing first time. And then for the very first time for the ORE Part 2 training, we're coming to Mumbai directly at the Phantom Head Suite and Simulation Suite in Mumbai to provide you with training for ORE Part 2. And the final bit is when you've successfully passed ORI Part 2, we are providing jobs within the UK as dentists as well. We have our own network in the UK of 1,200 dental clinics. And these clinics are working very closely with us in supporting all of you and providing jobs as well. So we're providing the full pathway from start to finish as well. And thank you for whoever circled ORI Part 1. I'm going to get rid of that annotation. Give me 1 second. Amazing. So the program overview, we provide support with ORI registration online. The ORI Part 1 training is fully online. There's 10 live sessions, each 2 hours each. And then ORI Part 2, we do 4 days face-to-face in Mumbai. 4 days will be full days online. And then just before your examination, we're providing 2 mock training days in the UK on our Phantom Ed suite as well. So what sets us apart from other providers? We are flying to the UK and providing UK tutors. All of our tutors are former ORE examiners and have been involved with training in ORE for the last 15 to 20 years. We're also going to be providing support with GDC registration, and ORE Part 1 is going to be fully online. So no matter where you are in India, you can log in and we'll be supporting you as well. Part 2 will be in your home country, Mumbai, and will be 4 days of face-to-face training. Again, we're making it very effective and time-wise competitive as well. We're also providing 2 mock days in the UK, and the pricing we'll go through later on is very competitive as well. And we have a WhatsApp support system for all our delegates. Our team, again, is very extensive with years of experience working within the ORE and previously IQE, previous ORE examiners, and we've got examiners and support staff from the Royal College of Surgeons as well. So firstly, I want to go through how we're going to support you with the GDC ORE registration. I'm going to call Dr. Anita, who has trained over 4,000 to 5,000 delegates in ORE training. Firstly, Anita, how are you keeping today? How are you?
Fine, thank you. Teaching today, so fortunately I've got a break, so that was great.
That's what I love.
But thank you.
Teaching. Now, it's an absolute honor to have you on board. And with your experience you have with ORE teaching, with over 5,000 ORE candidates going through your training, it's an honor to have you. And you're showing how committed you are. You're teaching live currently in Birmingham as well. If you want to just give us a brief overview of the GDC ORE registration and the documents required, please.
So for the documentation that's required for the GDC, of course, there's a checklist on the GDC's website. And when you start your process with us, we'll be sharing that as well in detail. But generally speaking, we need a dental qualification. So of course, you should have passed your BDS and you should receive your final degree as well. So without that degree, you would not be able to apply for the ORE. You'd need to have a statement of comparability. So it's known as the UK ENIC. And that certificate would then say that your qualification is similar to that of the UK. You need to have clinical experience. So you need to have 1,600 hours of clinical experience. That could be within your university setting, or it could be a combination of your university hours plus outside university. So I think even if you put just your internship year, that would amount to 1,600 hours or even more. English proficiency, they do accept a statement from your university if you have qualified in from a university which teaches in English within the past 2 years. If not, you would have to give the IELTS exam, and you need a score of overall 7, not less than 6.5 in each component. You would need character references, a certificate of good standing from your dental council, dental authority, and identification, and a passport and a recent photograph as well. So all these things are important, but it's also important how you complete your the form, the application form. So once you've completed everything, we'll help you check through that, because even small discrepancies can be rejected by the GDC. So we obviously don't want that. So we've got a robust team who will check that for you and make sure everything's in order.
Many thanks for that, Anita, as well. And what we want to do is make sure you pass successfully. Hence, as Anita said, our team will be supporting you, checking these documents. The GDC in the UK here are very particular of the documents, and this can produce time delays, which we don't want. So we'll support you throughout the whole process, and this is included within the pricing as well. So firstly, now coming on to our ORE Part 1 course. The course is to prepare you for the ORE Part 1 exam. The format is fully 100% online. It's going to be 10 sessions, 2 hours each, with interactive webinars. You're going to have interactive sessions. You're also going to be having the video recordings of the sessions provided until you pass the exam. So you can complete the course within 6 weeks. And as I said, you'll have full access to all the materials. And currently the fees for this is 95,000 rupees, which includes the GST as well. And again, my colleagues at the IDA will go through the pricing in more detail and support you regarding that as well. And this ORE Part 1 course includes the ORE GDC registration checking and that full process as well. So the whole format of the ORE Part 1 course is a fully online course. You're going to get CPD hours and a completion certificate. I'm just going to clear the annotation. Can I please request all of you not to draw all over the slides, as it does distract all our other delegates who are concentrating. So Dr. Ishak, please do not do that. Otherwise, it's distracting for all the other clinicians who've kindly logged in at the end of a long day. So again, we're going to get CPD hours and completion certificate, and the ORE Part 1, within those 10 live sessions, you're going to be covering everything from anatomy, pathology, oral surgery, histology, dental materials, law and ethics, and preventative dentistry as well. And again, the full list is available on a brochure, which the IDA team will provide to each and every one of you. Now going through the ORE Part 2 exam. Dr. Kish, do you want to give us a synopsis of the actual course of the ORE Part 2?
Yeah, so as Dr. Jin has already covered off ORE Part 1, as we've said already, if you pass both papers on ORE Part 1, you move on to ORE Part 2. So ORE Part 2 is designed for overseas qualified dentists, and it's a practical exam. So this hands-on course that we do and we will deliver will focus on key clinical stations, and as we've said already, delivered by our amazing team here. So delivery format is 3 days of mannequin skills training live in Mumbai, followed by a 1 day OSCE and medical emergency training in Mumbai as well. So it's a 4 days OSCE treatment planning and emergency training online, and 2 days mock exam prior to the exam in the UK. So you've got 4 training days in Mumbai, 4 training days online, and 2 mock exam days prior to your exam, ORE Part 2 exam in the UK. And the fees and payment is, course fee is 387,000 rupees. That includes your Indian GST.
Many thanks for that. And
Got a bit distracted there with all the squiggling going on.
Again, team, if we can avoid any of the drawing of the slides, Dr. Ishak, I don't know if it's you or you might be at home and it might be one of the children as well, but if we can avoid it, again, it's distracting for all the other delegates who joined in. So again, the ORE Part 2 exam itself, it's going to be 10 days in total with 4 days live in Mumbai, the rest being online with 2 days live in the UK as well. And it's going to be a fully comprehensive course. So what we're going to cover in Mumbai itself. Again, you got 4 full days. On day 1, we'll be covering all the safe practice, exam expectations, and we'll be covering practical skills. So we'll be doing amalgam class 1, class 2, composites class 3, and composite class 4 and 5 restorations. So it'll be a full hands-on session. We're going to be having 2 of our training team there and demonstrators as well from the UK. On day 2, we'll be covering the labial veneer tooth preparation and all the crown preparations with the different materials, from gold to metal ceramic as well. On day 3 in Mumbai, we'll be covering impression taking, temporary crown preparation, and covering root canal and composite cusp buildup. And the final day in day 4, we'll be covering all the live CPR on adults and children and demonstrating the basics and advanced techniques of basic life support and AED along with medical emergencies, drugs, and equipment as well. So that will get you prepared fully for the OSCE. The online components now will cover all the information regarding the skilled OSCEs. So day 5, you'll be covering everything to do with dental charting, surveyors, your hand washing, X-ray equipment, rubber dam, what to do with avulsed teeth, waste disposal, and all the OSCE information. Day 6 will cover all the written OSCEs with the online actors as well. Now we'll be conducting guidance on communication and how to manage that as well. And the final 2 days of the training of the course will be dental treatment planning and medical emergencies. So the full 8 days will give you a comprehensive overview and fully in-depth knowledge to pass ORE Part 2 successfully first time. And then we'll be providing you with 2 live mock sessions where before your examination, you will come for live mock sessions where we'll cover the mannequin preparation, OSCE, medical emergencies, and treatment planning as well. So a lot of questions I can see in the chat box about the job itself and how does it work. So firstly, on passing part 2, you will be registered with the GDC as a dentist. What we are providing you is the full end-to-end support. And along with this, we're giving jobs and relocation support as well. So our team in the UK and our 1,200 practices are supporting us to give all of you a relocation support package worth up to 40,000 UK pounds. What this includes is your first GDC year registration fee. This also includes the full support and payment of the initial registration, your immigration health surcharge, and your skilled worker visa sponsorship. It's going to be supporting you with the mentoring and clinical supervision. Again, we'll place you in the practices and you can assist there as well and observe so you get up-to-date knowledge of how to work in the UK. Our team in the UK will be supporting you with accommodation, opening bank accounts, national insurance numbers, your DBS application, which is your application you do prior to starting, and very important as well with your NHS performer number. Our team will help with all the needs and support and pastoral care, and again, will help with settling in the communities to help make sure you are safe and welcome here as well. And alongside that, with the Smile Dental Academy, we're providing free CPD and access to our hands-on courses as well. So you've got a full list here of everything that the team will support you with. Is there anything you want to add, Dr. Kish?
Yeah, just to say that, the whole reason why we've mapped it out like this is to make sure that once you've passed your ORE Part 2, the transition to moving to the UK is as seamless as possible. We understand it's such a big element to get up and move country. And we've also already supported so many overseas dentists in coming to the UK, helping them settle in, find a good community, find a support network within that community as well. And most importantly, get them practicing the clinical dentistry that they want to be doing in a good supportive practice with good mentors. The aim of this is to ensure that it's as smooth as possible, and to make sure that you are fully looked after from start to finish.
And even when you come for the exams, we'll provide you with support with the visas as well. So Saeed's asked a question. We'll support you on that aspect as well with our team here in the UK. So the jobs we have currently within our 1,200 practices, as I said to you, we're supporting you with the visas, with a relocation package. And what I want to show you is the starting salaries for the clinicians working as dentists in the UK. We want to work very closely with our 1,200 practices located throughout the UK, providing you with a very clear pathway. So as soon as you pass Part 1 examination, you will be given a guaranteed job worth £40,000 per year. And this is working within the NHS and some private as well, under a mentor to gain your NHS performer number. On successfully completing year 1 with all the support, in year 2, you would have now had your performer number and worked over a year now in the NHS settings. So we're saying you'll have a guaranteed income between 55 to 65,000 pounds as a minimum. We have a lot of clinicians in the UK in year 2 are earning a lot more than this. And the earning increases because now you've gained more experience in the UK. You know how the NHS rules and regulations work, but also you gain a bit more experience on private dentistry. So you're doing larger treatments and working on larger cases as well. By the time you come to year three as an experienced clinician, your salary minimum will be £75,000. And a lot of our clinicians working from India in the UK are earning £100,000 up. By this stage, you would have done a few more courses with us at Smile Dental Academy. You may have done some aligner courses, endodontics, implants, and aesthetic courses. And this way, you're offering a lot more to your patients. You're offering a lot more holistic care and a lot more private options. And by doing this, you're giving a wider and more complex NHS and treatment private caseload and taking up larger cases as well. I'm going to get Dr. Victor Gahani just to go through and add anything if he wants to add on this stage as well.
Yeah, no, thanks, Jin. No, I think what you've showed so far makes a lot of sense. It's a very clear, structured process. What Dr. Kish mentioned earlier, which is so important, moving countries and moving your whole family over is not easy. But the support, the networking, the structure that we will provide you to help you reestablish and re-enter a new country is going to be completely important and really, really useful. So don't take that to be a barrier as much as it can be. From my own experience from seeing candidates, whilst the online training on part one is really important to go through, you must complete that first before the part two. It is the part two where previously we find delegates do struggle. So I think the hands-on element, both in India and in the UK, will be very important for you guys because theoretically, and I'm talking from my own experience many years ago, theory comes to us quite naturally. It's the practical guidelines and the standards that change between the UK and India. And that's where the hands-on training will be really, really important. So I'm glad that's being provided really well. Thank you.
Brilliant. And again, we want to provide a full pathway. So you've got the full support. A lot of questions in the chat box about prescription exam support. All of this is provided and we'll support you in all of this. We've got a couple of questions. I'm just going to go through live as well. I'm going to get Dr. Anita. A lot of questions about the IELTS exam. Do you just want to confirm regarding that, what is required?
Yep. So about IELTS, if you are a recent graduate, that means within the past 2 years, and you have been taught in English, then you may not have to give the IELTS exam. So basically, when you start your program with us, we will be doing these checks for you and making sure that either you would have to give the IELTS or not. So we'll do that check for you. But if you are a recent graduate and you've studied in English, you wouldn't need to most probably give the IELTS exam. In every other circumstance, you would have to, if you are applying, if you are based in India and you're going to give the exam, traveling to the UK. There are other circumstances where you might not have to give your English exam, but then you would have to be based in the UK doing another program here, which is obviously taught in English, or you would have to be working here for a certain amount of time. But I think those scenarios would not apply to most of you who are going to be based in India and applying from there. So yeah, so IELTS would be necessary.
Many thanks for that, Anita, as well. So I want to go through a timeline and how this works. So the first stage you would do is enroll on our ORE Part 1 course. So the ORE Part 1 course, you enroll in it. What that means is we'll start supporting you with your GDC registration application. This application normally takes 60 working days to get a response to get a GDC application. And during that time, you will be studying with us on our 10 online sessions with the team to get trained up. So the third thing is you'll take your ORE Part 1 exam. Now, this happens, as we said, 3 times a year. We'll support you, letting you know when the exams happen. The team will support you on the visa prospect as well, and again, support you with travel accommodation and give you advice where to do that. Once you've passed ORE Part 1 exam, you can enroll on the ORE Part 2 training program. So there's a couple of questions. Do we need to enroll on both courses? I would say enroll on the Part 1 course. Once you've successfully passed Part 1 course, then you can enroll on the Part 2 course. This makes it more focused for you on the examination and training, but also cost-wise, it makes it more spread out and makes it more cost-effective. Once you enroll on the ORD Part 2 course with us, which will be 18 weeks in, you'll have 4 days online, 4 days live in Mumbai, and 2 days full mock in London. Now, there's a lot of questions regarding a lot of you already in the UK. Again, if you want to do any training courses in the UK with ORE, do reach out to us. That's already been running for the last 15 years, and we'll support you on this. This Mumbai and IDA connection is predominantly for our dentists based in India who want to do it in Mumbai to save you traveling for courses and training. So by 44 weeks, you would have registered, you hopefully would have passed your exam, ORE Part 2, and you would have registered with the GDC, at which time 48 weeks, you can apply for visas, will secure your jobs. So we're saying within 12 to 14 months, you will be relocating to the UK and working as a dentist within the UK. Again, this is the quickest timeline. Some may take 18 months, some may take 24 months. It go at your pace as well, but we're here to support you on that journey to make sure you are safely in the UK. And what we've done here is we've gone and the team at the IDA have worked out estimated total costs, everything that will be for your journey start to finish to working in the UK. You've got the GDC registration process, and there's a lot of fees that we need to pay, not just for the course itself, but the GDC in the UK, for your IELTS training for those who require it. So for the GDC process, the total cost will be around £541. For passing ORE Part 2, including your training, your visitor visa, your flights, accommodation, and these are estimates. Some of you may want to stay in a more grander, nice hotel. Some of you may want to stay in with family and friends locally. So we've worked out average costs for passing ORE Part 1 is about £3,000. And then for Part 2, including your travel for the examination, it's just under £10,000. So total estimated cost is about £13,000 from start to finish to get your access to the UK to work as a dentist.
Hi, my name is Himadri and I want to share my journey of coming to the UK as a dentist. When I first arrived, everything felt new and a bit overwhelming. But Smile Dental Academy wasn't just a place to study, it became my community. From the very first day, I felt welcomed and truly supported. The team didn't just teach me clinical skills, but they helped me understand how to work, connect and grow as a professional here in the UK. They supported me throughout my ORE course, which made such a big difference. Dr. Jin and Dr. Kish explained everything so clearly and we got to practice a lot. Because of their guidance, I felt confident every single day. I'm so grateful to Smile Dental Academy for helping me throughout and making me feel confident at home and settled here in the UK. Thank you.
And we just heard from the amazing Himadri, who's now working with us in the UK and in our clinics. We've helped hundreds and thousands of clinicians from India to work here. And a lot of you wondering why we're coming to the Mumbai to support you. As Indians ourselves, we want to support our nation and support the training needs as well. Currently, we are in Manchester, north of England. And this morning, we're with the Indian cricket team in the hotel, and we're off to see them play at Old Trafford this afternoon, the Pavilion. And we're very much passionate and patriotic towards our country. And we want to make sure all of you are supporting your journey to the UK as well. So it's an honor for us to be doing this as well and supporting the IDA and all of you. And we're here to support you for your full journey as well. The brochure, which the team will email out to you, has got all the FAQs, so frequently asked questions, in there as well. But the most important thing a lot of you be asking is, when is this all happening? So we currently have a waiting list, and our first ORE Part 1 course will begin on 1st of August 2025. And our ORE Part 2 course will begin in Mumbai 23rd, 24th, 25th, and 26th of August. which is fairly soon in Mumbai as well. And there is a waiting list starting, which the IDA team will kindly go through shortly as well. So thank you for everyone to joining today. There are a lot of questions in the chat. I can see questions going on and off. I'm going to go through as many as we can together and answer them as well. Dr. Kish, anything you want to add before I start going through the questions?
Just to say again, thank you to the IDA for organizing this. And then just to echo what Dr. Jin said, we've helped so many overseas dentists come over to the UK and support. And it's particularly important for us to be doing this for the Indian Dental Association, for our fellow Indians. It's such an honor and a privilege. And for us, everything that we do at Smile is about supporting and helping as many clinical dental professionals across the world, but it's so important for us to do this, especially back at our home in India. So really looking forward to it. And as Jin said, the dates are live. Part 1 on the 1st of August online, and part 2 we are live in Mumbai with you all from the 23rd to the 26th of August. So please do reach out to the IDA. Let's get booking. The spaces will go fast.
So I'm going to start going through a lot of the questions. I mean, those of you who are still in university completing your BDS, we are currently working with a lot of colleges within India and the government to provide the training within your syllabus. So we're working with the teams there. I think within the next 6 months, we'll have information of which colleges will be enrolling and rolling out our training within the syllabus. But to work in the UK, you need to complete your BDS number 1, and you need to complete ORE or LDS to get your GDC registration. So there's a lot of questions regarding the pathway for oral max fac surgery, oral pathology. Before you do anything, you will need to have passed your ORE part 1 and part 2. That will be the first stepping stones towards the UK and working there. Even if you got specialist degree and you're specialist in India, the first stage will be exactly what we've been through regarding this as well. So a lot of questions regarding job opportunities, which we've completed. Let me scroll down. Kindly, Victor has been answering a lot of it. Amazing. Some of you asking about, standalone veneer courses and prep courses and composite courses. At the moment, we're focusing on the ORE training in Mumbai. We're working with the Indian Dental Association and with Professor Dorbley with the view of providing further courses standalone. But at the moment, because of our numbers and the support needed, we're going to focus on the ORE training for now. Divya, you asked a lot of questions regarding all of this questions you're asking are in the handbook. One of the questions you're asking is, what are the drawbacks, advantages of settling in the UK as an Indian dentist? You know what? I'm going to get Victor, someone who qualified from India, just to answer that. Victor, someone who's, and I would say, forget being qualified from India as a dentist in the UK, you are up there as one of the top 10 dentists, clinicians, and your career has been amazing what you've achieved. What are the drawbacks and advantages of settling in the UK? And you could probably give your personal story as well.
Of course. Thanks for that. Thank you for those kind words. Really interesting question. So obviously for Indians, the major advantage, look, I think personally, it's, quality of life. Sadly, what you're valued as a general dentist in India now is very different to what you may have aspired to be when you joined your college when you were 18, 19, or however old you were when you started your BDS program. So quality of life in terms of earning potential, in terms of disposable income after expenses as a dentist in the UK is a lot higher than what I seem to understand from most of my friends back home in India. Now, that is also dependent on where you are in India and where you live. But in the UK, your quality of life is very, very different. Okay, this whole 9 to 5, work-life balance is much better or much more, favorable in the UK compared to what I see back home in India. And opportunities for kids, for your family to integrate with the area, with that is a lot more favorable in the UK personally. Drawbacks, I think if one was to look at family and social life, it takes time to integrate into the UK. Okay, so if you're leaving India with where you've got larger families, lots of friends, it will take time for you to integrate and make new friends. This is where we come in with Smile Dental Academy. You're going to have a extended family helping you integrate into the area, into the society. You're going to have friends who are dentists also working with you. So your journey should be a lot easier compared to the average journey of a dentist who, let's say, gets married and has to re-establish themselves in the UK. So I would say that's probably the biggest advantage and drawback personally.
Many thanks for your insights, Victor. Appreciate it. Snehal's asking, sir, but what about booking the exam? I've heard it's very difficult. So that is correct. It is very difficult to get places on the examination, which means when the places do come up, you need to be prepared. Where previously delegates had opportunities to keep on doing the exam and reapplying, you need to be prepared, have your course taken, and be confident you're going to pass first time for part one and part two exam. We're currently working with the GDC and the government to increase the places, and that will be happening every year. The number of places have increased, which is good and positive. And we'll be having further information soon regarding this as well. Again, those of you who have gone through our program, we will give you hints and tips of how to get the slot bookings for the examination as well. Kindly, Anita has been answering a lot of the questions in the chat, which I do appreciate. Perfect. I'm pretty sure the IDA have recorded this. What if we're done? A lot of questions. I do love it. Let's have a look. Nisha's asking, is there any way we can connect with the email for any further correspondence? What I would recommend, the IDA team and their marketing sales team will be supporting you with all the questions and answers. So anything, and the team will come on in a minute and go through it as well for you. Costs we've gone through. Is 10 sessions enough for preparation? And do we get all the study material and questions, past papers? Yes, 10 sessions online. You will get everything, your recordings. If you require further support, the team will help you on that as well. Is this available in Hyderabad as well, or do we have to travel to Mumbai? Currently, it's only Mumbai for the hands-on 4 days, but everything else is online. So it's not too far to travel from Hyderabad to Mumbai. Let's have a look. Do you help for visa forgiving? Yes, we do help for every visa. Yes, we do. Does the experience in India count during the job salary? Initially, for the first job you get is the basic standard. If you do have further experience, qualifications, then it will be useful. Then it may increase your first job salary wage. Yes. So if you have been working in an implant clinic and have placed over hundreds of thousands of implants and you feel comfortable, then yes, for the jobs you do apply, it will increase your wages. Those salaries I've given you are the minimum. A lot of you will get paid a lot more, but I do want to give minimum to show you your investment will be £13,000. With year one, you'll be earning minimum £40,000 as well. Saga's from Canada. Any support here? If you reach out to the team, they'll support you. Let's have a look what the questions we've got. Orthodontist with 11 years experience. So your process will be exactly the same. You'll need to complete part one and part two. And then you can work as a dentist with a special interest in orthodontics. To go on the specialist list with the GDC is a bit more tricky, and there are pathways we can support you on regarding that as well. Yes, we will give you training in the UK once you've completed part one and for part two training. Yes, you get the MCQ questions. So a lot of this we've already answered, which is amazing. I'm coming to the end of it now. Doctor, she's asking a good question here. What is the passing percentage of students in your academy who appear for part one in the first attempt? Anita, as our most experienced tutor, what is our success rates for part one?
Our success rate for part one is actually really good. It's 95%. That's in the first attempt.
Beautiful. And what we want to make sure is if we feel like you are not ready, I mean, I'll be honest with you, we teach at the Royal College of Surgeons in the UK, and we've got a lot of clinicians from India on their revision programs. And sadly, a lot of them are not even ready to sit the ORE Part 2 and never will be. So what we want to do is make sure we can support you from the start so you don't waste a lot of money, energy coming to the UK, and we'll support you from India. We'll go through your application from ORE Part 1. We'll know from your knowledge if you will pass
बार
successfully.
बार मीना ये बॉटल सारी गिर रही है यहीं पे धड़ाम
I'm just gonna.
I've just muted him, Dora.
I do love it. I do love it. So yeah, we'll help you on that aspect as well. Will there be a brochure? Yes, there will be a brochure. We'll be emailing out to all of you as well. And again, the IDA team, I'll get them on shortly. What about pursuing postgrad in the UK? So, Smile Academy is the largest postgrad academy in the UK. We have about 4,000 delegates going through our programs. We provide diplomas and master's level MSCs in pretty much everything in dentistry, from implants, aesthetic, restorative, orthodontics, implants, facial aesthetics. So again, for those you're interested, if you go to our website, smiledentalacademy.com, all the information is up there, but your first priority is to complete Part 1 and Part 2 exam. How to connect in the UK, as I'm currently in Crawley. Welcome to Crawley. If you reach out, we will help you out as well. A lot of similar questions. And I think that is it. Okay, no, we've got a good question here. What is the success rate for Part 2? So, Anita, final question. Success rate for Part 2.
Part 2 success rate is also really good. It's around 86%. Part 2, I think the delegates who have only come to our courses and not gone anywhere else, the success rate is even higher. So if we only exclude those people, our success rate is around 92% in the first attempt. But mostly delegates do go to other courses as well. So we would definitely advise that it's best to stick to one tutor, like one provider, so that you're not confused. I think there's a lot of information out there, and that's what gets people muddled, to be honest, in the ORE world.
Many thanks for that, Anita. Chitra is asking, good evening. After completing Part 2, we are sure of getting job offer or PLV position. Will you help in this and provide job offers in your clinic? Yes, so we will be, if you come and do Part 2 exam, we will guarantee a job for you. We're guaranteeing the job. We're guaranteeing a relocation package. We're guaranteeing the salaries as well as minimum. And this is not only in our clinics, this is within our network of nearly over 1,000 clinics. So we've got a big network. Myself and Dr. Kish run. You will have access to all the clinics, and yes, we will guarantee you a job and PLVE position. Provide how to apply for the exam. Again, go to the GDC website. Everything is on there as well. I think that concludes a lot of the questions because they're all becoming similar. So I'm very conscious of time, and it is exactly 1 o'clock. It was meant to be a 1-hour webinar. I'm going to stop sharing at this stage, and I'm going to kindly ask the team from the IDA to log in and to connect as well. And again, we genuinely appreciate everyone's time, and thank you so much. IDA team, over to you.
Thank you so much, Dr. Jin. It was such an insightful event session, and I would really like to thank you, Dr. Kish, Dr. Anita, and Dr. Victor, because I think you've really gone out of the way to answer a lot of questions. The questions are just pouring in, and I'm sure we're going to get a lot more inquiries here. So we are very happy to announce, we're just waiting for this part, that we are very happy to announce a Part 1 training that we are going to start from 1st of August, and there are very limited spots on this. So please get in touch with our counselor, Dr. Aditi. We are putting the number and her email ID on the chat box. Please refer to it and pour in as many questions and as much as possible, because we have very limited openings for this Part 1 training. And I sincerely urge that all of you all, think about this entire process of moving to UK. And if you ever take this decision, I think this is the right place to start with, right? You start here at the Fresh with IDA, and we take you from this journey and till you're successful there in UK and practicing in one of the clinics with Smile Dental. Right. So really thank you. And Dr. Jin has mentioned about all the timelines about the online program, offline program. So whether you're a part 1 candidate or a part 2 candidate, do get in touch with us and we will help you out with as much as possible with entire process of GDC registration, visas and placements and everything that we need in this process. So thank you all for joining us today. Please connect with our team and we hope to see many of y'all in our program, and we hope to see Dr. Jin and the entire team at Smile Dental very soon in August with a full batch of participants. Thank you all for coming. Thank you.
Thank you so much. And just to add, I want to say a big thank you to the IDA. I want all of you on this webinar to support them because it was their initiative, Professor Dorble's idea, and without their support, we wouldn't be there. So do support the IDA with everything they're doing. They've got a massive infrastructure, amazing network, and it's because of Professor Dorble we're coming to India. So we're very proud. So once again, from the Smile Academy team from UK, all of us, big thank you. Hopefully this afternoon we can watch India do well in the cricket, and we'll be posting that on the social. So those of you, if you do want to follow us on social media and Instagram, you'll find Dr. Jin Smile, Dr. Kish Smile, and we were the India cricket team. But once again, team, thank you so much.
Thank you so
amazing,
much.
amazing evening.
Thank you. Thank you.
Thank you, guys. Thank you very
Thank
much.
you very much.
Thank you.
Thank you.
Thank
Take
you.
care.